Welcome to Engineering Medicine. We'll discuss some of the latest research and developments in type 1 diabetes treatment and what they mean for the future of this condition. We'll also be talking about some of the challenges that still need to be overcome and how we can work together to make a difference. The current state of type 1 diabetes treatment. Type 1 diabetes is an autoimmune disease that causes the body to attack its own insulin-producing cells. Insulin is a hormone that helps the body use glucose for energy. Without insulin, people with type 1 diabetes must inject or infuse insulin several times a day to manage their blood sugar levels. Current treatments for type 1 diabetes are effective at managing blood sugar levels, but they do not cure the disease. People with type 1 diabetes must still monitor their blood sugar levels closely and adjust their insulin doses as needed. The future of type 1 diabetes treatment. There is a lot of promising research happening in the field of type 1 diabetes treatment. Some of the most promising areas of research include stem cell therapy. Stem cells are undifferentiated cells that can be used to create new cells and tissues. Researchers are studying the use of stem cells to regenerate insulin-producing cells in people with type 1 diabetes. For example, in the journal Nature Reviews Endocrinology, a group of researchers used stem cells to treat and replace damaged pancreatic cells. Gene therapy. Gene therapy is a treatment that involves changing the genes of a person's cells. Researchers are studying the use of gene therapy to correct the genetic defect that causes type 1 diabetes. As an example, in the journal Biomedicine and Pharmacotherapy, researchers are trying to use gene therapy to correct the defective genes that cause type 1 diabetes. Artificial pancreas. An artificial pancreas is a device that automatically monitors blood sugar levels and delivers insulin as needed. For instance, in the journal Diabetologia, researchers are working to develop artificial pancreases that are more accurate and user-friendly. The challenge is ahead. Despite the progress that has been made, there are still challenges that need to be overcome to develop a cure for type 1 diabetes. Some of these challenges include the complexity of the disease. Type 1 diabetes is a complex disease that involves the immune system, the pancreas, and the brain. This makes it difficult to develop a single treatment that will work for everyone. The cost of biological treatment. Current biological treatments for type 1 diabetes can be expensive, and this can be a barrier to access for some people. The need for long-term follow-up. People with type 1 diabetes need to be monitored closely for the rest of their lives. This can be a burden for both patients and healthcare providers. What we can do to make a difference. There are several things that we can do to make a difference in the future of type 1 diabetes. These include funding research. There is still a lot of research that needs to be done to develop a cure for type 1 diabetes. We can help by supporting research funding. Investing in biotech innovation. Biotechnology companies need to raise money to commercialize their lab research to successful treatments for people. Advocating for better access to care. We can advocate for policies that make it easier for people with type 1 diabetes to access affordable care. Conclusion. The future of type 1 diabetes is bright. With continued research and innovation, we are closer than ever to finding a cure for this disease. In the meantime, there are several things that we can do to make a difference. By funding research, investing in biotechnology, and advocating for better access to care, we can help to ensure that everyone with type 1 diabetes could live a long and healthy life.